anterior
remove the
muscle.
skin, exactly, behind of the skin we can find
Muscle. A fat.
superficial fat. We call superficial fascia.
Facial.
You know superficial fascia we can find in most part of the body, but in the thorax, inside of the superficial fascia, you are able to find the mammary gland, the breast. So the breast, the mammary gland, is inside of the superficial fascia in anterior wall of the thorax. In this picture, I remove the skin, I remove the superficial fascia. Superficial fascia, inside of the superficial fascia here, I remove the breast, the mammary gland. So, the first, the superficial muscle in anterior wall of the thorax that I am able to show you, it is a triangle muscle. You know the name. We call pectoralis major. We call pectoralis major. Such as the other muscle, we can explain the origin and the insertion. Means the attachment of the muscle. About the origin of pectoralis major, if you read, if you study, according to this picture, some of the muscle fiber attached to the clavicle. To which part of the clavicle?
Inferior?
All leg? No. Only
To the medial edge.
medial border to medial side. Okay, anterior border to medial side. Some of the muscle fiber attached to the sternum. Some of the muscle fiber attached to the costal cartilage. And some of the muscle fiber attached to the upper nerves of the muscle in anterior wall of the abdomen. About the origin, please remember this picture. Some of the muscle fiber attached to the clavicle. To which part of the clavicle? You know the clavicle consists of superior surface, inferior surface, anterior border, posterior border. This muscle is coming to attach to the anterior border. Okay, anterior border, medially or laterally? Medially. So, the muscle fiber attached to the clavicle. Which part of the clavicle? Anterior border. Which part of the anterior border? Medial. Some of the muscle fiber attached to the sternum. Some of the muscle fiber attached to the costal cartilage. And some of the muscle fiber attached to the upper nerves of the muscle in anterior wall of the abdomen. If I want to explain for you exactly which costal cartilage, you should know. The second costal cartilage to the sixth costal cartilage, the pectoralis major in all of the person is going to attach. Second costal cartilage to sixth costal cartilage. About the first and the seventh, we have variation. It is possible. For example, for the study, you find that the muscle pectoralis major has attachment to the first costal cartilage. For the monomer, you find that the muscle fiber attached to the seventh. For example, for the another person, only to six, only to the second to the sixth. Never has any attachment to the first and never has any attachment to the second. And in another person, you find from the 1 to the 7. So we have variation. Again, I repeat about the costal attachment. About the costal attachment of the pectoralis major, remember, second to sixth, in all of us, we have attachment. About the first costal cartilage and second costal cartilage, we have variation. When we explain about the variation, you should know. Variation means it is possible in some person attached to the first costal cartilage, in some person attached to the second costal cartilage, in one person attached to the 1 and to the 7 costal cartilage. In another person, it is possible never attached to the first and to the 7. Okay, variation means this. All of the muscle fiber converge laterally make a tendon. This tendon is going to attach to the
Humerus.
humerus. Which part of the humerus? Here you
Intertubercular.
have
Anterior.
intertubercular
groove.
groove.
Anterior.
Intertubercular groove is such as this. Intertubercular groove. This groove has two borders, lateral border, medial border, and a floor. This pectoralis major is going to the humerus attached to lateral border of the intertubercular groove. Okay? About each muscle, I should explain for you the innervation. You know, in the auxiliary fossa, we have a bulge, we have a bundle of the nerve. This nerve, this spinal nerve, are going to attach to each other through a spatial pattern we call brachial plexus. A brachial plexus here, a brachial plexus here. You know the brachial plexus. You know, the brachial plexus has so many branches, such as the lateral pectoral, medial pectoral. Lateral pectoral and medial pectoral are responsible to innervate the pectoralis major. This pectoralis major, what about the function, action? What do you think? According to the original insertion, it is going to
Adduction.
Adduction of the arm.
Adduction. Medial.
Add the dot, medial rotation,
Rotation.
okay? Adduction,
Extension.
medial rotation, and flexion.
Flexion.
When you get a tube here and you want to raise your body, one of the muscles that is active is pectoralis major. So pectoralis major is the adductor and medial rotator, and also help to flexion of the shoulder joint. If you head to your mother in the kitchen, if you see a fresh meat, you see all of it there, a white thin covering sheet you can remove.
Yes.
Yes, it is a deep fascia. Deep fascia is near the muscle, and never you can find any fat inside of the deep fascia. But in superficial fascia, it is full of the fat. Perhaps the superficial fascia of the cow, the superficial fascia of the sheep, you eat. But about the deep fascia, you remove from the meat and then use this meat. Now about the deep fascia or the fascia that cover the pectoralis major, we call the fascia pectoral. So fascia pectoral cover the pectoralis major. What's the name of the deep fascia that cover the pectoralis major? Fascia pectoral.
Then there is not like a fixed attachment for pectoralis major.
Such as the muscle fiber. Cover the muscle fiber, attach with the muscle fiber.
It's
to
different
the bone.
from someone to other.
No. It is completely for cover the muscle and attach to the bone. Okay, this is deep fascia. It's not important exactly the attachment because it is such as the muscle.
I hear we don't have a deviation because it's make breathing is difficult. So
Each muscle is going to be covered by the fascia. Okay, and a fascia that cover the muscle we call here deep fascia.
it's present.
Yes, you see, you can see. The pectoralis major is important for breathing, but it is not the main muscle. Because it has attachment to the costal cartilage, can help to you to increasing and decreasing the size of the thorax, but it is not the main muscle. The diaphragm is the main muscle. Now look at the picture. If I remove the pectoralis major, exactly behind of the pectoralis major, exactly deep to pectoralis major, you are able to find another triangle and a small muscle. It is visible here. Because
Pectoralis minor.
pectoralis minor. And also if we notice the pectoralis minor, another fascia without fat is going to cover the pectoralis minor. Because this fascia covers the pectoralis minor and another small muscle that we call the subclavius, the name of this fascia we call clavipectoral fascia. We call clavipectoral fascia. What's the name of the fascia covered the pectoralis major? What's the
Clavipectoral.
fascia that covered the pectoralis minor and
Clavipectoral.
So clavipectoral is a fascia that covers the subclavius muscle and the pectoralis minor. Pectoralis major, subclavius, pectoralis minor, all of them are going to form for you the anterior wall of the axillary fossa. All of them are going to form and attach to anterior view of the bone in the thorax. So we are going to explain about those. About the pectoralis minor, we come to the origin. What do you think? We are going to attach
Coracoid
to
process.
which rib? Third?
Fourth and fifth.
Fifth. But we have variation. Sometimes you can find some muscle fiber attached to the second. Sometimes you can find some muscle fiber attached to the sixth. This variation. But normally, the origin is the third, fourth, and fifth. What about the insertion? We are going to attach the coracoid process
Of the scapula.
coracoid process of the scapula. What about the innervation? Brachial plexus. Do you remember the innervation of pectoralis major? Medial pectoral, lateral pectoral. Only the medial pectoral is responsible to innervate the pectoralis minor. In dissection room, if we dissect correctly and in detail, we are able to show you the medial pectoral nerve. This medial pectoral nerve in dissection room, you can find that at the first innervate the pectoralis minor, this pectoralis minor, innervate the pectoralis minor, perforate, and then it is going to innervate the pectoralis major. About the function, we have to the coracoid process. The clavicle is here, the scapula is here, and this muscle is going to attach to the scapula. So with the contraction of this muscle, it is possible to protract the scapula. It is going to help another muscle to protract the scapula. About the subclavius muscle, it is between the first rib and inferior surface of the clavicle. So you remember subclavius group. It is between the first rib and inferior surface of the clavicle. We call subclavius muscle. The brachial plexus have the spatial nerve for this muscle. We call nerve to subclavius. Nerve to subclavius. This muscle is bringing the shoulder to the downward and in front.
Depression.
Forward. So bring the shoulder forward and downward. Also, this muscle can fix the sternoclavicular joint. This muscle also can fix the sternoclavicular joint.
By fix you mean stabilization?
Means what?
Stabilization?
Stabilization, yes. It's going to fix or stabilize the sternoclavicular joint. So the anterior wall, some of the muscle, we already look at this picture. What's the name of this muscle?
Pectoralis major.
What's the name of this muscle?
Deltoid.
Between the deltoid and pectoralis major, you have a
Cephalic.
groove, muscular groove. A vein that it is the superficial vein is visible here. We call cephalic vein. The name of this groove coming from the name of these two muscles, deltopectoral groove. Okay? Deltopectoral groove or infraclavicular groove. If you explain about the infraclavicular groove, means you are going to explain about deltopectoral groove. Inside of this groove, One of the items is cephalic brain. Later you are going to read about the arteries. And here we remove the skin inside of the superficial fascia. We are able to show you the mammary gland. If we remove the mammary gland, we will be able to show you pectoralis major. We will be able to show you the pectoralis minor. Now look at this picture. Who is ready to explain for us from which view we are going to look at?
I think this is the what's it called? This is the medial border of the rib cage. This posterior surface of the what's it called? Sternum. Yeah.
We can see this picture. What is this coronal section? If I put the knife here and go down, we have a coronal section. This anterior surface I rotate to. Okay?
Yeah.
So here you are going to look at the posterior surface of the sternum. In this view, I am able to show you in each side a muscle. A muscle we call transverse thoracis. We call transverse thoracis muscle. What about the original insertion? Superior attachment, inferior attachment. The superior attachment, some of the muscle fiber attach to the second costal cartilage, and some of them are going to attach to the sixth costal cartilage. Inferiorly, they are going to attach the xiphoid process to inferior posterior surface of the sternum to some of the costal cartilage. Okay? What about the innervation? The intercostal nerve are responsible to innervate these transverse thoracic muscles. You explain for you. What about the function? When they contract, what happens?
The rib cage becomes smaller.
They bring downward.
Diaphragm.
Yes, not diaphragm. Diaphragm is here.
Chest.
They bring the
Chest.
chest wall inferior. Okay? They bring inferior. Now, here you are going to look at two intercostal muscle. If you look at two intercostal muscle, they are very thin layer of the muscle. I explain here, and then another part of the muscle remain for tomorrow. Only tomorrow I'm going to ask you. Please study carefully tonight. I told you, at least 4 hours each day you need to study by yourself, not in the class, by yourself.
But doctor,
And if you want to pass, if you want to manage the time, if you want to be relaxed for the exam, okay?
but I think we should stop.
No,
stop
after the
right now.
class, in Tehran University, they have class until 5. And we explain all of the muscle in 2 or 3 hours. It is their problem if they want to read. But for you, from tomorrow morning, just now I'm going to explain for you and ask you, do you get that? I never ask from the Iranian, do you get that? They are responsible to get. Okay? So please, when you come back to the home dormitory, at the first 1 hour you have relaxed, eat something, do something, everything. And after that, try to read. After any 45 minutes, give to yourself a break, 15 minutes break, okay? And please, not for my class, for all of the class, whenever you want to have class from the 8 morning to the 3 or to the 5, prepare something for the rest. For example, bring something to sweet or drink, something to eat. Something for the first break, something for the second break, for the third break. You need to eat. It is a culture, it's a good culture. You are going to be a doctor after the 7 years. You should be healthy to be able to think better. When I put a picture and consult to you, be able to find the cervical ribs very fast. Okay? So be careful about your health. The night before the day that you are going to come to the class, please prepare something for yourself. Imagine how many breaks I have. For example, we are different. It is possible I want to eat a sandwich, another want to drink a tea. It's something that make you to get fresh. It is the last thing that today I'm going to explain. In each of the intercostal space, we have 3 layers of the thin muscle. We call intercostal muscle. How many intercostal space we have?
13? 12 or 13?
7, 6.
11. 12. Between two adjacent ribs, we have intercostal space. So we have 11 intercostal space. In each intercostal space, we have 3 thin layers of the muscle. Here, you are going to look at one of the intercostal space, and these 3 thin layers of the muscle are visible. We call the external intercostal, internal intercostal, and innermost or intima intercostal muscle. So external, internal, innermost or intima intercostal muscle. Here is the costal group. You know about the intercostal neurovascular bundle. They are passing through the costal group. You explain for me. These intercostal neurovascular bundles are passing through which intercostal muscle?
Innermost.
Between the innermost and the internal.
It is important. Look at the external intercostal muscle. Superiorly, they are going to attach to the inferior border of the superior rib. Inferiorly, they are going to attach to the
Superior border of the inferior rib.
Inferior. It is superior rib, it is inferior rib. Inferior border of the superior rib and superior border of the inferior. Look at the direction of the external intercostal muscle. Imagine you want to put your hand in the pocket of your, for example, pants or trousers. Remember the direction of the finger from the superior to inferior, lateral to the medial. These are going to remember you the direction of the external intercostal muscle. This external intercostal muscle is going to be appear near the vertebral column, and they are going to be continued until the anterior end of the ribs. Only between the costal cartilage, this external intercostal muscle is going, look at here, the color change. The muscle fiber disappear. The muscle fiber disappear. So the external intercostal muscle between the costal cartilage is going to be continued to a aponeuros, to a membrane. We call external intercostal membrane. External intercostal membrane. In which part of the intercostal space you are able to find the external intercostal membrane? Anteriorly, near the sternum, between the costal cartilage. What's the name of this membrane? External intercostal membrane. Another name you can use, anterior intercostal membrane. You can tell anterior intercostal membrane or external intercostal membrane. Now, if I want to show you the internal intercostal muscle, look at here. Internal intercostal muscle. If you notice to internal intercostal muscle. This internal intercostal muscle, look at to the muscle fiber. They are right angle to the external intercostal muscle. If they are coming from the lateral to the medial, they are going
Medial
from
to
the medial
lateral.
to the lateral. They are right angle to each other. So the function is different. It's the opposite.
They are not posterior.
The function is opposite. Bring for me the function of the external intercostal, the function of the internal intercostal, and the function of the innermost intercostal muscle. Tomorrow, you should bring for me the function of this muscle. About the internal intercostal muscle, look at here. This internal intercostal muscle is going to begin between the costal cartilage. If you remove this membrane, exactly behind of this membrane, you are able to look at the internal intercostal muscle. This intercostal muscle, internal intercostal muscle, is going to attach superiorly to the superior rib, inferiorly to the inferior rib. Superiorly, exactly, it is going to attach to inferior border of the dorsal groove, and inferiorly it is going to attach deep to attachment of the external intercostal muscle. The muscle fibers are right angle to the external intercostal muscle. They are going to be found near the sternum and cover the intercostal space. Look at here, we remove this part.
Any
Near-
points because the course does not show up.
You misclicked.
Look at here. It is the external intercostal muscle, internal intercostal muscle. The muscle fiber right angle to each other. The internal intercostal muscle superiorly attached to inferior border of costal groove. Inferiorly, it is going to attach to the superior border of the inferior rib deep to external intercostal muscle. If you notice here, this part of the chest thoracic wall removed. Look at near the vertebral column. This white color is going to remember you that the internal intercostal muscle is going to begin here near the sternum, and when they are going near the vertebral column, they are going to change to the membrane. This membrane is near the vertebral column and we call posterior intercostal membrane or internal intercostal
membrane.
membrane. What's the name of this membrane?
Anterior intercostal membrane or external intercostal
Yeah.
membrane. Posterior or interior intercostal membrane.
Okay. And about the intima. This intima are superiorly are going to attach to superior border of the costal groove, and inferiorly it is going to attach to the medial surface of the inferior rib. Between the intima or innermost and the internal, these neurovascular bundles are passing through the costal groove. You should know these innermost or intima only are going to be found in the middle part, not anteriorly, not posteriorly. In each intercostal space, you are not able to find the innermost muscle, only in the middle part. And all of this muscle, you should bring the function, and you should know all of these muscles are going to be innervated by the intercostal nerve. So these intercostal nerves are responsible to innervate this muscle. What about the function remains? Okay. Thank you.
Okay.
I'm coming back to the dormitory with you. So